Thank you. So late one evening, a young mom came into our emergency department, and she came in with her daughter who had been unwell enough to keep them both up overnight for the last couple of nights. She came in, she was exhausted and frazzled. So one of our ward clerks noticed. She went over and talked to the mom. She made her a cup of tea and held the baby, which gave her a chance to sit for a moment, to gather her energy, and to have a conversation with that ward clerk. To this day, it was that act of compassion that that young mom remembers about that trip to the emergency department. It's also this act of kindness and many others like it that keep the ward clerk coming back to work day after day. Kia ora koutou. My name, as mentioned, is Johanne Egan, and I'm an emergency medicine doctor at Waitemata, and I've also done some work over the last little while around thriving in the emergency department. I've had the pleasure of listening to stories just like this one in the search for our thriving as healthcare workers in the emergency department. It's research that is a little bit different from our normal medical research. Normally, we would often search for an objective truth. But thriving is an experience that we have as a human being. It is immersed in variability, in subjectivity, in emotions, and it turns out it's immersed in spirituality as well. Let me catch up. So spirituality, when thought of from a broad definition, this is a definition or a way that Richard Egan has spoken about spirituality. Full disclosure, he's my brother. Spirituality is about what is of utmost value. It's a values lens that asks what really matters. What really matters most to me, to my family, to my community, to our country, and to our world. What I'd like you to do now is we're going to have a speed date with thriving. And I want you to think about a moment at work when you had a burst of energy, or a moment when you felt like, yes, this is why I come to work every day. I want you to think of that story. Turn to your neighbor, and one of you get a chance to tell that story. The other person who doesn't get a chance, hold on to it and tell somebody at afternoon tea. You've got 1 minute. It truly is a speed date. Okay. Our stories are powerful. The things that we notice, the stories that we tell one another are powerful. The energy, the positive excitement, the laughter that was here in the room lifted the atmosphere here. It made a difference. And this is true of all of our stories. Our research went and asked people about these stories in a way that it enables us to see the things that are already within healthcare, the things that are already there, very common spiritual practices, such as forgiveness, acts of kindness, compassion, connection, and wanting to help other people. We know that organizations that focus on these positive practices, they have positive outcomes in almost every measurable metric that they can look at. In our research, having asked for these stories of people staff within the emergency department, the stories once asked for in a similar way to here in the room, they were overflowing. It often takes a little while to remember, thank you, your positive story, because our negative stories tend to come to us more quickly. But once they were asked and people heard, it just rolled off the top of their tongue. And from these stories emerged eight themes of our thriving. The first of these three, one of them is self-care. And within caring for self-care was the obvious. Eat good food, get good sleep, connect with your friends and your family, connect with nature. But there was also a sense of getting to know yourself, of understanding what your values are, of having an ability to be compassionate towards yourself, of having an awareness of what triggers you or the impact that you have on other people. And within that awareness, then being able to have a little bit more control over the way that your life goes. Know-how came through strongly in our stories. There's an inherent joy in learning new things, in understanding new things, and also in teaching, in passing on some of that knowledge. And the theme of know-how came through really strongly in terms of an embodied sense of that know-how. Not just knowing it in your head, but in a moment, being able to pull that piece of knowledge or that right skill or the team around you to be able to make a difference in somebody else's life. Closely related to that is achieving, our third theme. We love, in the emergency department, we love fixing things and we love excellence. And certainly that came through not only in and of itself, but also when our achieving was a part of making a difference in somebody else's life. The next one's connecting, wove through all of our stories of achieving. We've heard again and again today around spirituality and mental health, this idea of connecting and how central it is to our being of human. And that certainly came through in our stories. It was not only connecting with one another, connecting with our colleagues, getting to work and knowing a friend is on with you is like, whoa, it doesn't really matter what the shift's like, you know that you're going to get through it. But there was also a sense of connecting that we noticed with our patients. Insert here whatever it is that you call the people who come to see you. I know that we all call them slightly differently. I do call them patients, but being able to see them and the difference that it made when their family or whānau arrived. All of a sudden their need for pain relief was reduced. They kind of came alive. I remember one person who I really thought was actively dying. And her family arrived, and she was so much more animated. It makes such a big difference. Appreciating and being grateful. This really seems to accentuate what the small moments of thriving that are there in our everyday, that are often overlooked. The work that we do, helping people, easing distress, saving lives, however that looks. This is really important work. It inherently has meaning and purpose. And yet, that is so much more tangible when we are valued, when we feel appreciated. Having fun definitely came through in all of the workshops that we did, but it came through as a theme of its own. Having fun or humor helps, it's a pro-social thing. It helps to lubricate some connection. But there was also a sense of giving you a little bit of perspective. That humor gives you a little bit of perspective with a bit of cheerfulness that you can kind of reframe and relook at things, which seemed really useful for our thriving. Two more themes, seeing the essence within. We saw this most obviously with acts of kindness. Getting somebody a blanket because they were cold, or a cup of tea. Having somebody, buy a pizza for the staff because it had been a really busy shift and nobody had got a chance to have some dinner. It seems that this theme is about seeing you as a human being and connecting with people as a human being. The last one, making a difference, wove through all of the themes. It enables us to see our meaning and our purpose. It grounds us in that meaning and purpose and enables us to fly. Once we discovered these themes of thriving, we were then able to dream about what our department might look like when we were noticing these things more often. And not only that, we were then able to think about how can we value these things. None of them are particularly amenable to metrics in the kind of way that we measure that we gather metrics in other aspects of our emergency department. And yet, these were the reasons why people got out of bed and came to work. How can we value that so that we don't lose them? And that became a particular focus of our work. It turns out that spirituality, that lens of what matters most, that realization that we are inextricably, I knew I was going to stumble on that word, connected to one another, that we are interrelated not only with one another, but also our world and our environment. That kind of spirituality, that it was interwoven in all of our stories of thriving. We set out to understand and discover thriving in our emergency department. What we found was what matters most to us. What we found was what matters most to us as human beings. We found love. Thank you.
you. Have they almost feel a little bit like values? Have they kind of become that for you, or?
So yes, certainly they've become values, and I've done a number of workshops, and I'm starting to do them sort of more broadly across the organization, and that's really what I'm kind of trying to deliver is, you know, these are things that are most important to each of you, and interestingly, across different spaces and even commercially in a trucking organization, they came up with very similar things. You know, there were a few variations on the theme, but they're kind of all about being human.
Yeah, they touched on me, so I would do. So
yeah, and so coming back to actually these are our values, and then the real trick, which is where I'm at now, is okay. So these are our values, but how do we walk them? You know, it's easy to talk about them. It's easy to feel when they're not there.
Yeah.
But how do we actually walk them, and how do we treasure them, so that we don't lose them in amongst all of the other busyness.
Thank you.
Yeah, awesome, beautiful presentation. So in terms of that sort of embedding them or operationalizing them, how far along that journey is your organization? Are you with that process?
That's a really good question, and I think that we're at the beginning.
Sure.
I think that I think internationally there is a wave that is synonymous with this same wave that people have been talking around spirituality. You know, there is a discontent with the way that things have been in many organizations. The idea of looking at our staff and our organizations and our world as something that we can just use and abuse. You know, there's definitely a discontent with that. That actually we are each people, and we want to be valued, and we want to do good work. And I think that when you ask people, everybody has such great ideals and dreams and ideas, but the difficulty is in walking that within the culture and the environment that we have. And we are starting to have those conversations, and I suspect that they are, you know, looking at that and finding ways to walk our talk is contextual. I think it's probably going to be a little bit different in every place, but having those conversations and creating that space to build some awareness of, you know, what are we doing and how are we doing that? How is, you know, what I'm thinking or my language, how's that impacting on you? You know, I think I'm trying to empower you, but is that what I'm really doing? And trying to create some space for those conversations and that learning going forward, I think is really important, but we're at the beginning.
Final question at the back. It was interesting what you were saying at the start about the ward club, because I've experienced and heard of stories where people have had every opportunity to talk to the nursing staff or the doctors or anybody else that's got a tertiary education qualification, and then they've just poured out this enormous amount of information to the cleaner or the tea lady or somebody else that they've never met before in their life, because they felt that they can talk to that person but not to anybody else. So providing them the right person to talk to is an enormous issue.
Absolutely, and I fully admit that I was humbled by this work. I did one of the workshops I did was with ward clerks, and you know, from a different profession you assume what you know other people do. And you know, the why they came to work and the things that they did astounded me. I had no idea. I figured they registered the patients and made it possible for me to do my job. I had no idea that actually often patients remember what they did in their interaction with the ward clerks, or as you say, the cleaners. You know, and I think that this work is applicable to, you know, to everybody. That we, you know, and certainly in the emergency department, we are very aware that our whole team makes a difference. You know, if that room's not clean, I can't go in there. If the trolley isn't stocked with the equipment that I need to, you know, to save a life in the moment, then I can't do anything. You know, and being in those situations and realizing actually every single person who's involved in this, you know, from all sorts of different levels, make this happen. It's not just about me, which sometimes is doctor's weakness.
Joe, thanks very much for a very engaging presentation on very important work you're doing. Please join me in thanking Dr. Joe. Thanks so much.